Welcome, everybody. Thank you for waiting. We're letting folks in from the waiting room. Welcome to the Fredericton Roundtable. This was already a crisis. The intersectional impact of COVID-19 and gender-based violence against non-status, refugee, and immigrant women, NSRI women across Canada. We started this roundtable series now on April 30th, which feels like a long time ago. And by we, I mean the Building Leadership Capacity to Address Gender-Based Violence Against Non-Status Refugee and Immigrant Women project. We introduced this roundtable series to really and as an opportunity to host conversations and exchanges that would consider the differential impact of COVID-19 on this particular community, thinking about non-status refugee and immigrant women. It's an opportunity for community members, organizational leaders, non-status refugee and immigrant women to be sharing their strategies, their practices, their lived experiences. And it's also an opportunity for us to work out ideas in conversation. We've expressed this at all of our roundtables, which is that we're not focused on leading, but we're focused and interested in leveraging and hosting these conversations at a national level. We adopt a social justice approach that suggested a more comprehensive analysis, so a deeper analysis of the issues that we're talking about, and a more collective discussion of the social problems we're talking about can yield more effective social action, advocacy, strategies, and responses. We want to start by saying thank you to everyone who's here today, where we've been heartened by the number of people that have registered across Canada and that have been joining us. My name is Margarita Pinton-Perez, and I'm the Senior Coordinator of the Initiative to End Gender-Based Violence at Advocacy, the Ontario Council of Agencies Serving Immigrants. Joining me today as co-hosts of this conversation are Nira Algueta, Project Coordinator at Advocacy, and Jeanette Gautreau from the New Brunswick Multicultural Council. So the New Brunswick Multicultural Council is a regional partner on this project, and Jeanette has supported the organization of this roundtable, and we're delighted to have speakers today from the Multicultural Association of Fredericton and the New Brunswick Immigrant Women's Association. Nira? Oops, you were on mute.
Hello, Ana. Okay, thank you. Thank you, Margarita. So for today's meeting, we encourage you to be in a speaker view so you can follow along with our shared screen. We want everyone here today to participate in today's conversations in ways that feel comfortable to you. At the same time, to minimize distractions and keep a safe space, we have disabled the camera option and microphones are mute for all participants. Throughout today's presentation, we will have one of our team members attending the chat. You will have the ability to chat with other people, send us messages or a message to everyone participating today. We encourage you to share comments, feedback, and if you have technical issues, please let us know and we will do our best to support you. I will compile a list of questions and comments which we aim to address in the last 15 minutes of the session. If we don't get there, we will do our best to respond and follow up when we share our recordings, the PowerPoint PDF, and a feedback survey in the following days. To start with the chat, I encourage you to share your location and the organization, networks, or communities you're joining us today from.
Thank you, Nira. And Jeanette, if you'd like to please read our land acknowledgement for today.
Absolutely. Thank you for welcoming us at this table. So in the spirit of reconciliation, we acknowledge that we live and work on the unceded Wolastoqey and Mi'kmaq territory here in New Brunswick. We are reminded that the lands that we have been welcomed to were previously occupied by independently thriving Indigenous societies, and that waves of immigration have resulted in a deep and long history of forceful disruption to Indigenous peoples' traditional ways of living and their land. And we're grateful to be welcomed on these lands, and we pay our respects to the nations on this territory before us.
Thank you, Jeanette. So just to start, I'm going to share with you a little bit about our project. And Nira and I are going to give you a little bit of an overview and very briefly touch on where we're at with this project. But when I'm referring to the project, what is it about? It's the building leadership capacity to address gender-based violence against non-status refugee and immigrant women. And this is a 5-year project that's funded by Women and Gender Equality, so formerly Status of Women. And it's part of their GBV, their national GBV strategy, so Canada's strategy to prevent and address gender-based violence. This project falls within the pillar that's about supporting families and survivors of gender-based violence. And what you're seeing right now on the screen is this project is very much organized and comprised of different service organizations and community partners and academic partners across Canada. And it's a growing network. So it's a growing network of service providers, organizational leaders, community members, advocates, and at this point, it's led by OCASI, the Ontario Council of Agencies Serving Immigrants, and we have partnerships with organizations that are based in Edmonton, Ottawa, Toronto, and Vancouver. We're going to be able to kind of give you a little bit more background, but I'll let Nira kind of go through the objectives and the agenda for today, and then I'll come back in.
Thank you, Margarita. So the objectives in front of you. So the objectives for today's meeting are to learn about our project, the research and blueprint in progress, to learn from our speakers, community members, organizational leaders, and advocates reflecting on how we do community advocacy work to address gender-based violence against non-status refugee and immigrant women in Fredericton. And we also want to hear about the challenges of advocacy work and the importance of this work, especially now in the context of COVID-19. The agenda for today, Marguerite, thank you. The agenda for today we will be covering a lot of information. Copy of the slides and recording of the conversation will be shared with you on a later date. If at any point you need to pause, take a break, please do so and check it with yourself and a colleague. Remember that you can post any questions in the chat at any point of the presentation, and we will take some time at the end to respond to those questions. Margarita?
Great, thank you, Nira. All right. I had a few things popping up on my screen earlier when I was saying about the project and sharing with you that we have regional partners across Canada. I hope I also mentioned Fredericton, who's here with us today. So just really briefly, I'm going to share some project objectives. Our project really calls attention to the urgent and unique issues of GBV against non-status refugee and immigrant women across Canada. One of the goals of this project is to build a strong national network among service providers, organizational leaders, community members, advocates, and non-status refugee and immigrant women to strengthen the regional and national work being done to address GBV against NSRI women using survivor-led and community-based advocacy models. To accomplish this, what we're doing is we're taking 2 promising practices that are already underway and that exist in Toronto. The building leadership, so what we're focusing on here is building the leadership capacity of communities, organizational leaders, advocates, and NSRI women to really prevent and respond to GBV. And we're doing this through the Peer Champion program. And the Peer Champion program uses, is a program that, and this is Nira's program that she coordinates, but it's a program that uses popular education to build leadership capacity and foster connections between NSRI women. This is one of the promising practices that we're modeled after. The other practice that we're modeled after is the Rights of Non-Status Women's Network. And this is what we're referring to as a community advocacy network. And a community advocacy network is a strategy which establishes grassroots networks among non-status refugee and immigrant women survivors, service providers, and other civil society leaders in order to build a community capacity for developing survivor-led, evidence-based solutions to GBV. So I'm going to go over who we're modeled after. So just kind of give you briefly a little bit of background. In the case of the community advocacy networks, we're modeled after the Rights of Non-Status Women's Network. And I know there's some members of that network that are joining us today on the call. So the Rights of Non-Status Women's Network for over 14 years It's a grassroots network of service providers and activists, and they've been gathering to strategize around how to best support women with precarious immigration status and how to help them deal with the multiple forms of violence in their lives. The Rights of Non-Status Women's Network uses a community-based model to be more responsive to gaps in supports for NSRI women, as well as to develop a shared analyses of the policies that affect non-status refugee and immigrant women communities. So things that the Rights of Non-Status Women's Network do, for example, is they organize educational forums for service providers on issues such as housing, mental health, the impacts of immigration law, just to give a few examples. And the network really focuses on grassroots advocacy, building capacity for developing a diversity of solutions that are not necessarily constrained in the same way by service user models. Something that's cited as a frequent benefit of the organizing efforts of the Rights of Non-Status Women's Network is that it shows really how the strength in informal networks. So the strength in having these kinds of gatherings and these places where members can meet and strengthening this kind of networking that happens among service providers and that's fostered through the activities. And it's been seen as beneficial for creative case management, for building mutual support, as well as really strengthening a shared analysis across various silos in the sector. So creating kind of a shared base of knowledge and understanding of some of these issues. We heard from the Rights of Non-Status Women's Network at our last roundtable, sorry, not our last roundtable now, our roundtable over the summer, so July 30th, and we have a recording of that, and I know that Nira is going to share the link for the Rights of Non-Status Women's Network if you'd like to check out their website. And what you're seeing on the screen right now is some of the campaign work that they've done, and one that's more recent, which is the campaign work that they did that's during COVID. So you can see that here with the piece that's been all over Twitter and that you can also share as well. Nira, do you want to share a little bit about the Peer Champions program?
Yes, of course. So as Margarita mentioned, the goal of the Irc Nff campaign, so the Immigrant, Refugees, Communities, Neighbors, Friends and Families campaign, the NFF or Peer Champion campaign, is to build community-based responses to address gender-based violence among immigrant and refugee communities. The campaign creates strong connections with community leaders who have deep and trusted ties with their communities and refugees and organizations serving those individuals and their communities. Peer champions are trained to identify and support newcomer women experiencing violence and to educate their communities about the effects of violence against women among immigrant and refugee communities. I can show you a little bit now of some of the events that usually peer champions conduct. So here's a small sample of some of the events created and run by the peer champions in 2019. Every year, some 15 to 20 peer champions from across all over Ontario are selected based on their leadership skills, knowledge of how violence affects their communities. Once those peer champions receive their training, they go back to their communities to run educational events. Peer champions have the freedom to create and deliver their community education events in whatever forms or ways that fits the needs of their communities. Peer champions deliver community events in faith spaces, students' unions, neighborhood groups, in the workplace, or in places that we have called and identified as to be entry points, like language schools, food banks, and drop-in centers. Margarita?
Thank you, Nira. So we wanted to share a little bit. So we're saying here that what we're doing is we're implementing these two promising practices in different regions across Canada where we have our partnerships established. And now I kind of want to share with you a really important part of our project, and it's the work that we did last year in 2019, which was the research that we did. So kind of to give you a sense where we're at, we've completed the research that we did in 2019 that I'm going to share with you in a little while. We've organized and analyzed that data. And what all of that information is intended to do is to really support us building a blueprint. And what is a blueprint? A blueprint really, it's like a practical how-to, a resource that'll provide an outline of how those promising practices that we just mentioned, how they can be replicated by other organizations and adapted to other local contexts. So to give you what's really important here is that we're mentioning 2 promising practices that have been underway and developed in Toronto. So something really important for us was also to, in designing this project and thinking about the research is an important part for us to be able to test some of our assumptions. And not only assumptions that we might have in terms of the way that these problems are being analyzed or talked about, but the assumptions about doing this kind of work in other regions. Also something that we set out to learn, we set out to learn more about what are the local realities in the different regions that we're partnered in. So we went to Ottawa, we went to Vancouver, Edmonton, Fredericton, where I was able to meet some of the speakers that are joining us today as well. And we had questions around what the advocacy strategies and the types of supports and services or survivor-led models that were developed or that existed in those regions. And we had questions around whether or not it aligned with some of the work that's happening in Toronto. And it gives us a sense of how might we adjust our approach to really build and support what already exists. And something that's really what you're seeing right now on the screen is when we shared our research findings, this is a graphic kind of summary that allows you to see where this research journey took us. So if you look at the top left, there we are, the group that completed this research. And there's something really important here, which is we were, wanting to challenge some assumptions also around some of the terms that we're using, because just as popular as some of the terms about building leadership, advocacy, survivor-led, just as popular as they are, sometimes they can be quite confusing or vague or being used in different ways in different regions. Perhaps it's not being labeled in the same way. So for us, it was really important to know what these terms might mean or how they're being interpreted, but more importantly, how they're being used. We also really used this opportunity when we were doing our research to put our values into practice. And it's also an opportunity for us to meet people and build relationships. So we were able to meet other people that were completing and doing this work at the community level, organizations, organizational leaders. And something that's important that comes out of this is it allows us to create a baseline. So an understanding of where we are, where we're at when we started, and then allowing us to kind of capture as this project continues to come to life. As I mentioned earlier, it is a 5-year project. And so for some of you that might be wondering, well, what year are you in? We've completed the first year, we're now in our second year, and the second year is really about implementation. So this is the part where you see it come to life, where the peer champion and the community advocacy networks come to life in each of the regions. So, and I'm going to share a little bit just briefly because for time, I want to jump into the conversation with our speakers, but just very briefly, let's see, can you see all of this slide or do I have to press enter? Is that, here we go. All right, so in terms of what our research looked like, just very quickly, we completed an environmental scan, a needs assessment, and what we did today and what I'm going to highlight right now is that during our environmental scan, we did consultations and focus groups with service providers, over 76 service providers, which included community advocates, organizational leaders, and we asked questions around existing supports and services that are rooted in community-based advocacy and survivor-led interventions that support non-status refugee and immigrant women. And so something that's really, that came out of those conversations is we learned kind of able to kind of get a scan and a mapping of what exists in those regions, and also hear from people what they feel might be missing as well. We also heard about what some of those challenges are to doing the work, and I'm going to be able to cover a little bit of that in what follows. But next, Nira is going to touch on what was more our needs assessments when speaking to non-status refugee and immigrant women.
Thank you, Margarita. So we also conducted focus groups and interviews with 49 non-status refugee and immigrant women whom we recruit through our partner organizations and the stakeholders we consulted. We use a participatory, community-based, and trauma-informed approach in designing the focus group. For example, we pilot our questions with a group of non-status refugee and immigrant women, survivors who provide critical feedback to our project.
Great.
Margarita?
Great, thank you, Nira. 1 second. All right. So in terms of, we shared a lot of information. As you see, there's a whole graphic recording from that roundtable that we hosted. That was July 16th. But just to kind of give you a sense, something that I want to highlight today is that during those consultations that we had, we really heard about the great and important advocacy work that is happening across the regions, and also really learning about the unique position that service providers in particular in the anti-violence sector, in the immigrant and refugee serving sector, the unique position that they're in engaging in public policy advocacy to raise awareness on issues related to GBV, and in particular, gender-based violence and the intersections with immigration status. So it's important for us here, what we've done is we were able to kind of capture this type of typology of advocacy that takes place, which is a way for us to kind of identify the different forms and different channels in which advocacy happens. And so there can be softer ways in which advocacy happens in planning tables or councils or smaller working groups. We can see it at a more formal level, for example, with cross-sectoral kind of collaborations. We see it through advocacy campaigns that might be happening through, for example, sanctuary city campaigns, also informal programs and supports that are created, and community gatherings as well that are organized more by grassroots, civic or faith-based groups. And then informal networks that can be more smaller, like neighborhood get-togethers by residents, and that are gathering informally, maybe not as frequently, but still where there's a strong practice of connecting people, and that the focus also be on how to improve accessibility to supports and services in the community. Let's see if I can go to the next. All right. And at the same time that we learn about all of this great advocacy work that's happening, we also really heard about the challenges of doing the work, the systemic challenges of doing the work, the issues of capacity, the issues of funding priorities that limit what people and what service providers and the work that they can be doing. And we also really touched on how advocacy is frequently this kind of invisible labor. So what people were referring to as doing it off the side of their desk. So it can also lead to the work being overlooked or commonly underfunded. But advocacy work is such an important element that really shapes and pushes forward the work of addressing gender-based violence against non-status and refugee and immigrant communities. It enables organizations, service providers, and communities to push for access of all their members of their communities. In this case, what was really emphasized too was immigration status. So it's part of this, what we were capturing here is these kinds of systemic shared challenges that we've heard across the regions, and also a history of this work. In lots of ways, we're hearing about the history and how much it's decades of work, and groups have been doing this for so long. So there's this historical kind of piece that we're also capturing that allows us to also not just learn about the history of the regions and not just the historical details, but really points us in an interesting direction towards capturing the work in the way that we can also create a shared, more collective vision for how to do advocacy work when we're thinking about gender-based violence against non-status refugee and immigrant women. All right, so very quickly, what does that mean for us? So in that kind of charting of the research journey and the challenges that we heard, we're capturing then this blueprint. Okay, so what does this mean for us? What does it mean when we're thinking about establishing community advocacy networks in different regions and supporting that work and leveraging existing networks? How can this work be further completed? Like, how can we support this idea of capacity and support if we do it collectively? Identifying shared priorities, so these shared kind of systemic barriers, can we also create ways in which we're organizing to advocate and to support service providers? And what happens, for example, when we're not navigating these systems in isolation or just certain organizations or one person within an organization, but when it's carried out collaboratively, so we're working together. So we're thinking about how to do this work at a collective scope, this national and also regional scope. And it really, for us, this is part of what the Community Advocacy Network is about. So really trying to help create advocacy plans and develop alternative responses for addressing GBV against non-status refugee and immigrant women, supporting the partnerships among different groups and organizations to continue to expand their leadership and their work that they're doing to address gender-based violence against non-status refugee and immigrant women. And as Neera will kind of point out as well, this integration of survivor-led, right? So what does that mean? So this is also thinking about how can we support equitable opportunities so that non-status refugee and immigrant women, survivors of gender-based violence, are able to collaborate and integrate and participate in these project activities as well. Mira?
Thank you, Margarita. So as Margarita mentioned it, we needed to listen to non-status refugee and immigrant women and to test our ideas, right? So we needed to hear from their impressions of the terms safety, healing, leadership that are too central to our project and what it means for them to be a survivor. Were they comfortable with the mainstream definitions? More significantly, we wanted to hear their own definitions. What does it mean, all of that, to them and their experiences with gender-based violence? How did they experiences and perspective challenge our assumptions about what a survival-led project might look like? The non-status refugee and immigrant group of women that we interview challenges the assumptions of survival, migrant women, leader. They introduced us to the ideas of community forms of healing, promoting safety. They also talk about promoting neutral spaces and places to access services and creating safety spaces to build community. So what all of this means in the creation of a blueprint at a national level that is inclusive of non-status refugee and immigrant women. What does all of this mean for us when we're supporting and engaging with non-status refugee and immigrant women who are the peer champions, the leaders of their communities? It means that we need to reimagine leadership. We need to reimagine survivorship as a process. We need to rebuild community-based safety. We need to make a space for holistic healing, sports, drop-ins, and joys, and things that women told us that they wanted to do. It includes having non-status refugee and immigrant women having a central part of the creation and delivery of programs. It says that we need to avoid framing survivorship as a one-time static event or label. Instead, consider how surviving is an ongoing process, not limited to one source of oppression. It challenges ideas about safety and healing as only individually. What about collective safety, collective healing from structural harms? What about including spaces where non-status refugee and immigrant women are already participating? What about creating capacity for healing outside of the survival level? Are those neutral places where humanity can be restored? What about spaces for joy, community, and shared healing? Margarita?
Thank you, Mira. Thanks so much. So as we mentioned, we're not going to go and provide any further details about this piece of our project with the research. We do invite you to check out our website. We also have recordings of when we hosted a roundtable that was focused on the research. So all of that is archived on our website and you'll be able to access that online. I don't want to take any more time. I want to now go to start our roundtable discussion. One second here. For today's roundtable session, and for those of you who have joined us, what we do is we organize it around 3 questions. So in this discussion, speakers are invited first to participate and highlight, to first answer a question around the kinds of community-based advocacy and survivor-led work that's underway in their region. And then the second question allows them to speak to some of the unique challenges and tensions that might impact doing that work. And then our last question is grounded in the context of COVID-19. So it's really a question about why is this work in particular that urgent and critical during this time. So when we're talking about advocacy and survivor-led work. So I invite our speakers to turn their cameras on. Jeanette, Liliana, Natasha. One second here. So we have with us today, we have Jeanette Gautreau, who will be starting the session, and she'll be providing us with some opening remarks, and she's from the New Brunswick Multicultural Council. We also have with us Liliana Calava, Director of Settlement Services for Adults at the Multicultural Association of Fredericton. And we also have Natasha Akhtar, who is joining us from the New Brunswick Immigrant Women's Association. It's so nice to see you and to have you join us today. I had the pleasure of meeting you in person, which was now almost a year ago. So to start off, Jeanette, it'd be great for you to kind of start the conversation with us and to kind of share a little bit of the context of advocacy and the development of programs addressing gender-based violence against non-status refugee immigrant women in New Brunswick. And I know that you're in kind of a unique position because you had the opportunity of doing research in the region, observing and speaking to this, I think is a great way to just start the conversation.
Absolutely. Thank you very much, Margareta, and thank you to my two other colleagues and Fredericton friends, Liliana Natasha, for joining this afternoon. So I do want to kind of set a little bit of the context about like who we are and what brought us into this project, and as well the general context of what's happening in the immigration space in New Brunswick right now, and what world we're operating in our province, and kind of getting into a little bit more of the specifics of this work. So just quickly to introduce myself, my name is Jeanette Gautreau. I'm the Assistant Director with the New Brunswick Multicultural Council. So in some ways, we're kind of the New Brunswick counterparts to Advocacy. We have 17 member agencies across the province, settlement agencies and ethnocultural associations, of which Liliana from the Multicultural Association of Fredericton is a member. And so we've worked in this specific space of looking at gender-based violence against immigrant women through a project that started a few years ago that I coordinated 2016 to 2019. And it looked at basically the way that our services in the province were adapted to the needs of immigrant women. So looking specifically at the domestic violence and intimate partner violence services, transition houses, second stage housing, social work, the police forces, these kinds of services. So we conducted similarly a research project at that time in consultation with a number of immigrant women, of service providers, settlement agencies, as well as the kind of DV sector, to try to understand the gaps and the strengths in the sector. And it resulted in a resource document as well, where we provided recommendations for essentially how to bring a cross-cultural lens and an immigrant lens to the service delivery. Out of that project, the project focused on other communities, so not in Fredericton specific. So a little bit of New Brunswick geography. We focused a little bit on St. John and Moncton and the northern francophone part of the province. And there were some good partnerships that came out of that work, and some better blend of services. So a lot of the settlement agencies started to build bridges and stronger relationships with some of the domestic violence service providers in the area, and have a little bit more dialogue and conversation, which I think was really, fundamental to at least opening up the conversation and trying to get a better understanding of the immigrant community. But there's still a lot of really complex challenges that still face our province that I'll touch on a little bit over the course of my little intro here. So to take a step back and to look a little bit at the provincial context right now that we're operating in New Brunswick, in terms of COVID, this feels a little bit cruel for anyone west of New Brunswick, but we've had less than 200 cases in the province, and we're kind of operating in this little dream Atlantic bubble where most of the services are opening up again. And so we've had kind of a bit more of a limited impact here in our province. Nonetheless, it's obviously had an impact on all the service provision. Domestic violence shelters and service providers are still limited in their capacity of how many people they can take in. A lot of services have moved to virtual, or there's a virtual element before they can be in person. And so it still complicates the service delivery across the province, even if the impacts haven't been quite as severe as in other parts of the country. For us as an organization, we moved very quickly in the height of the crisis to establish task forces with our settlement agencies. And in particular, we had a case management task force where we reached out to our settlement agencies to find out if there were any families that were particularly vulnerable. So to make sure that all the clients that we had and everyone that we're working with, if they needed food, if they needed housing, if they needed domestic violence supports, that we were there to support them immediately. So that's one of the things that we did during the height of the crisis. But since the summer, it's been a little bit on pause because for the most part, services have more or less resumed to some new normal across the province. At a political level and what's happening in our immigration space, if you watched the news recently, New Brunswick had a provincial election in September, and we now have a majority Conservative government in the province. A few days ago, they announced a new cabinet, and for the first time in history, New Brunswick now has an immigration minister. So we're very curious and going to keep an eye on this, because for a province that never had an immigration minister and where immigration always operated in the space of economic development and employment, we're curious if a new immigration minister that has a bit more of a broader mandate can help advance some of the non-employment related issues with regards to immigration, and if any of the issues that we raised today will kind of be able to move forward in our political landscape. In terms of numbers, we have some fairly ambitious numbers for the province. So our current government still maintains that immigration is a priority for our province. We have a demographic crisis in New Brunswick. We're a little bit of the canary in the coal mine for the rest of the country, where population is aging. And we're looking at essentially a 1% of our population target in immigration. So looking at about 10,000 newcomers a year by 2027. It's possible that those targets could increase and be even more ambitious for a province of about 700,000 people. In comparison, last year we had 4,000 newcomers arrive in the province. So we're looking at more than doubling our immigration population in the next few years, which is really ambitious and really wonderful. And we're looking forward to the diversity that brings to your province and all the opportunities. But for those operating in this space, in the space of kind of retention and making sure that there's equity and justice, it also raises a number of flags, because we know that there's a lot of service gaps and a lot of issues that, if they're not addressed prior to essentially doubling our immigration population, could result in some pretty severe issues across the province. So we're keeping an eye on that for sure, and working to address some of those gaps. One of the main sources of immigration in our province is through the Atlantic Immigration Pilot, which brings newcomers in more rural communities in the province, as well as in our urban centers. But this is driving immigration in rural communities across the province, and that's particularly interesting to us because the service delivery in rural communities might not be the same as in the urban centers. And there's a lot of issues with regards to access to services, access to transportation, access to housing. And in the space of gender equity and looking at the spouses and children and how they're integrated in the community, we're kind of keeping an eye on this, because in rural communities where oftentimes it's allophones and non-anglophone francophone speakers who land in francophone communities, and whether the spouses or and children are properly integrated into the services and into the community, we're seeing high rates of isolation, and we're seeing cases where the spouse has no language capacity, and there's not necessarily the service delivery of the language courses and the community connections, especially with COVID now, which even prevents further women from kind of going out in the community and connecting with peers. So we're looking at that isolation factor in rural communities as well, and how we can do some of that, how we can support better the rural communities across the province. Another big item on our kind of priority list this year that we're looking at, and I know this is an issue across Canada, but we're also facing a bit of a housing crisis in the province as well. So right now our vacancy rates across the province are around 2%. In some cities it's a little bit higher or lower depending on where it's at, but the quality and the type of housing might be an issue as well. So we see this as a big gender issue too. We also have families, immigrant families with a larger number of children or intergenerational living, and our current housing situation does not lend itself well to that. I think Liliana can probably speak to this pretty significantly here in Fredericton, because we know that this is a massive issue. So we're trying to look at some of those, how do we navigate this, and what are some of the innovative solutions that are happening across the country to make sure that people have housing. Currently, nearly 30% of newcomers, latest statistics, spend over 50% of their income on housing in New Brunswick. So we know it's an income issue, it's an economic issue, it's a livelihood issue, it's a mental health issue, and it's a gender issue. So this is a massive challenge, and it's just as much of a challenge in rural communities as urban communities. And what we fear too is that in some cases, especially with temporary foreign workers, that housing is often provided by the employer. So what happens is the employer will purchase housing or build new housing and then rent it out to their employees. And in a case where you have individuals who are attached to an employer for their job, for their housing, for their transportation, and basically their entire livelihood in the province, especially with temporary non-status residents, that raises a number of alarms for me in terms of human rights and possibilities for abuse. We don't have a lot of statistics and data on this. We hear some anecdotes in some of the more rural communities where the isolation rates are high as well. So that's an area of concern. And the final thing that I'll say before kind of leaving the space for others to answer questions as we kind of head into the space, one of the other major challenges that we have in the province is that there are next to no supports for non-status immigrants, non-status migrants in the province and asylum seekers. A lot of our settlement agencies are primarily funded to work with permanent residents. Some of the larger agencies like MCAP or Liliana Works or others might have some diversification of funding to be able to support in crisis situations, some non-status, international students, temporary workers, and they might be able to offer some limited supports to other communities. But aside from that, in a lot of rural communities and across the province, there's no awareness and there's no services for non-status and precarious status women. So this is a major gap that we highlighted in our research, and something we've had a number of cases come up over the years of people being in very precarious situations and not knowing where to find supports, and oftentimes they rely on very much the goodwill and the limited crisis resources of services across the province. So that's an area of concern for us and an area that we're looking into a little bit more to try to find some pathways of support for non-status and precarious status migrants in the province. So I just wanted to set a little bit of the context on some of the main priority issues that we're looking at, just to kind of paint the picture when we're talking about advocacy and we're talking about the work that these agencies are doing to kind of understand what's the environment that they're working in.
Thank you so much, Jeanette. And yeah, you really painted a picture. You really, I mean, the way that you're able to kind of walk us through that, the context and some of the challenges, and a lot of these kind of intersecting challenges when you're saying like it's a housing issue, it's the income issue, like all of this that you're mentioning. And it's really concerning, as you say, because I learned that a lot from you, that it's a really ambitious plan in terms of where the province is heading, but and we can share the report that was that came out of the project, because you really do identify kind of some of those major challenges and gaps, and identify also and offer some recommendations. So we can share that with those of you who are on the call today if you're interested. Next, we're going to start now with our speakers, with Liliana and Natasha. And I'm going to start with Liliana, and sorry, I don't know if I can see. Oh, Liliana, yes, you're there. You've got your camera on. Just remind you to unmute. So we're going to start with you, Liliana. And the first question is, what are ways in which you practice community-based advocacy work to address GBV, gender-based violence against non-status refugee and immigrant women in Fredericton? And and kind of a probe or a follow-up question to that is, what makes community-based advocacy work unique, like a unique approach to addressing GBV against NSRI women in Fredericton?
Thank you, Margarita. Thank you for your questions and for inviting me to participate in this really important conversation about really important and the challenging issues around gender-based violence. As you said already, I work with the Multicultural Association of Fredericton, which is an organization that offers services for kind of hands-on services for newcomers, frontline services. We have area of very broad services, starting from the settlement information orientation to needs assessments and assets assessments and referral services, language classes, employment services. So really, we are working from the holistic approach of looking at we are able and lucky to be able to see different issues in a kind of address and see in a holistic way. Just because we have so many services that we are offering. So when we're looking at the IPV, intimate partner violence, or cases like that, we find that women feel more comfortable to come into our organization. People will not assume that they're coming for this specific reason. They may come for a number of different reasons. And we work also from the services that is informed by the trauma-informed care. So we look for opportunities to ensure that women feel safe and that they can speak about issues and challenges they face in a safe manner. So we find that that's really important part, to be able to assess the needs, and then to be able to support women to access services that really address the needs that they have. So as an organization, we welcome newcomers in both official languages, French and English, as well as over 40 other languages that we have on staff. So we are very proud of our organization and proud of the way that we are able to work cross-culturally, to have, that's an asset, and it's quite unique in our community to have an organization that has such a cultural diversity like ours. And then on top of the staff that we have who speak other languages, we also work with the program with the cultural brokers, which are people in our community who are immigrants who speak French and English and then other languages. So they enhance our capacity to connect with our community members and with our clients through languages that we might not have on our staff. So that reminded me a little bit when Nira was speaking about the project that Rights of Non-Status Women Network has with the peer leaders model. And I was really interested to hear more about the training that this program offers to the peer leaders, because this is what we are working with our cultural brokers. We offer workshops monthly for cultural brokers on helping them understand our services and the community and the system and how the system works. And for example, one of the workshops that we do, it's around the family violence. I don't know, probably most of you know of the federal government website, Welcome to True North, Strong and Free, which is a resource and information website on family abuse. So that's just an example of the workshop that we offer to our cultural brokers. So on top of that, we also have, for example, assist training, which is suicide prevention training. So really is to enhance capacity of the newcomer community. And cultural brokers are like our, what they say, low-hanging fruit. They are people who have enough English and French, and then they just need to enhance. It's easier to help them understand how our community works and information about law and requirements and what is considered as intimate partner violence. So they are then our branches in the community, and they are able to share the knowledge that they got from these workshops with those who have more of the complex challenges, maybe people who have not had education in their life, or don't speak English or French, or who have a harder time to access some of this information. So that's a model that we use. We work with newcomers in one side, and then on the other side, work with the service providers. So for example, we have service providers on site. So some of those service providers are like Fredericton City Police. We also work with the mental health and addiction services, our New Brunswick Social Development Department, which provides low-income housing, also child protection services, income assistance. So they have a big area of services that they offer. So representatives of these organizations come to our site once a month at least to spend time with our clients to provide information on their services, what they offer, how people can access the services, but also for them to learn more about who is in our community, because at the Multicultural Association, we offer language classes on site, and we have probably around 300 people every day accessing language classes. So it's really an opportunity for these service providers to meet with diverse immigrants and to learn about some of their challenges firsthand. The other benefit for the service provider is that there are so many languages on site here, so we can support them to learn more. So if they want to talk to a client, if they want to offer services, we will help them with interpretation. So we will have people there to help them out. So it's really looking at this kind of holistic approach of providing services, but also working with partners who giving them something instead of just asking, because we know that oftentimes for those service providers who are also many times not-for-profits, like for example, our transition house staff, they always struggle with resources and struggle to provide services to a local community. So when we bring a next layer of somebody who's an immigrant, who also has a very different cultural identity, who has struggled with language, they just see that and as additional work for them. And by us offering to bridge that gap and support them to learn in kind of friendly, not threatening atmosphere about these different challenges, they appreciate it. And we find that in that way, we are able to build partnerships better and start on the positive foot. So when we have crisis situations, we were able to work it in a way that the service providers will connect with us first and say, okay, we have this client. Do you have cultural broker or interpreter that can work with us? Do you work with this client? How can we make more of a case management situation rather than just the service providers working on their own from the situation where they don't really have lots of information? So we find that that kind of approach is working for us. It does take lots of effort, and it does take lots of our resources, but we find that it is a very important issue, and that service providers in our community don't have lots of experience, or they don't have a capacity to work with the non-status immigrant refugee women without support of the service providing organization. So to be able to really successfully support these women, we have to be involved, even though, it is not part of the settlement services, right? It's further kind of, yes, but much more than settlement support services. So we always ensure that we have capacity on our staff. So we have, as I mentioned already, staff who speak many different languages, and every time we have new groups with different languages coming to our communities, we look for people within those groups to hire to work with them so that they can help us understand what the group is facing, and also that they can help us transfer the information to that group. beside that, we also look for people who have different professional backgrounds. So we have on our staff social workers, we have people who have a medical background, pharmaceutical, all kinds of different professions, so that they can also help us in a different areas. So I would be really interested, as I said, to learn about the format of the training that the Rights of Non-Status Women Network offers to, offer to our cultural brokers, and to learn about, what they offer, and if there are other organizations like Ocasi, or if there is a trainings that we can access online for our staff and cultural brokers, that would be really of good interest for us.
Thank you, Liliana, and thank you for covering so much there. And in terms of the training that you're mentioning, I think what I understood is that you were mentioning the peer champion program. That
Yes.
This project will have a peer champion. Part of the program, part of the project includes the peer champion, but there's also the peer champion piece that's more focused on the bystander model, which Nira is currently coordinating right now in Ontario. And I'm sure we'll be able to share more information if, Nira, you want to share maybe the website information there as well. I really like the way that you were able to kind of walk us through all of those pieces. And I guess one thing that I wanted to ask and follow up with you is that when you're mentioning these partnerships and you're mentioning some of the work that you do to support what sounds like other mainstream services, right? Would you consider these more like formal partnerships, or how does that work as well? And I'm just curious also because I'm thinking about when we had our conversation, this is now last year, but sometimes also a high turnover, or if staff are changing at some of these organizations, that kind of relationship is so important. I'm just curious how you might describe that, if it's more of a formal partnership, informal, how would you say that?
It is formal partnership, and we had the representatives, for example, with the Fredericton City Police. There is a community policing department, and we had at one point one person, and that person retired, and then Fredericton City Police put forward the next person. So this other person is now with us, and it's good to have one person or two people who are really learning more, and they kind of strengthening their capacity to know more. So that person is like a resource person now for Fredericton City Police when there is situations that maybe they are called for the emergency, for the family violence, or then this person that works with us is their resource person that they can connect with, and they say, okay, what do we do next? How do we respond to this in the appropriate manner? Because they don't have, in our situation, unfortunately, Fredericton City Police doesn't have a budget or people that can help them with interpretation. So they solely rely on us. So we are always, making sure that at the meetings, and we highlight that fact, and they understand as our partner that this is not acceptable, that this is something that they need to work on. So they work on it as the police force. They are trying to enhance that capacity, but we are working along their side as they are improving on this. So always looking as how do we support these partners so they feel that we are on their side, and how we can help them move forward in their process of becoming more or having more capacity to work with the clients that are coming from diverse cultural backgrounds. And our also police runs, they have a committee that they call Cultural Diversity Advisory Committee that both Natasha and I sit on. So that's their effort to show that they're really interested to improve in this area. But of course, things don't happen overnight.
Okay, right. Thank you, Liliana. That's really important. And I hear also, coming from what you're sharing with us, also just the different with the cultural brokers and the pieces that you're doing to support the mainstream services. You're advocating for, non-status refugee and immigrant women through that work, in ways that you're saying are supporting and through those partnerships as well.
Yeah, holistic, all way kind of working always work is really crucial. It's really hard to choose and pick one area, but it's really important too.
So thank you, Liliana. We'll bring you back shortly so we can talk about some of the challenges of doing that work, and also kind of in this context of COVID-19, because I'm curious also to hear about those task forces that Jeanette was mentioning. But next, I want to bring Natasha to participate with this question. Hi, Natasha. How are you? Are you okay? We've got you on. You're
Forget
unmuted.
to unmute myself.
Welcome. Welcome. So the same question for you, Natasha, and if you want to just quickly share, Natasha's joining us from the New Brunswick Immigrant Women's Association, and the question is also, asking you about community-based advocacy. So how do you practice community-based advocacy work to address GBV against non-status refugee and immigrant women, and what makes community-based advocacy unique, like a unique approach in addressing GBV against NSRI women in Fredericton?
Right. So I came to this from a personal point of view. So my trajectory was a bit different. I was an immigrant myself, and I did not have, I think, the advantage of coming on my own. I think that when you are a woman who's from a conservative male-dominated background, you can expand more if you are coming on your own. In my case, I was, within a marriage, and so I had all those experiences. I was an immigrant. I was in that sort of relationship. I also had the additional disadvantage, I would say, of being a ethnic and religious minority. And all of those sort of inform what you know, like they inform that's your lived experience. And it sort of just gave me a very nuanced perspective of all the multiple challenges, which I think you all know about what it is to be an immigrant person who is in a different country. You're not aware of the resources that would be available to you if you had, the advantage of growing up there. And you are also, one, you're not informed, you don't have networks. All of these were explored really thoroughly in the project that Jeanette mentioned earlier, the Overcoming Barriers Project for Immigrant Women. And I would, I say that to everyone, that was a landmark in New Brunswick. That was a landmark project, because before this happened, and I have lived the story, so I know there was no conversation about the challenges faced by immigrant women, non-status women, not even on the map, probably because populations are lower than they are in the other provinces, and New Brunswick is relatively new to immigration. So as a result, this was not even something that was a conversation topic. And all of that, I would say, changed with this project. As far as I was concerned, it was a godsend. Very grateful that the New Brunswick Multicultural Council and Mira McQueen partnered for that, because it changed the conversation in this town. I don't know about other towns. Jeanette would know better because she's been traveling, but it made a huge difference. So its research is extremely important to opening up people's minds.
Mm-hmm. I think we lost Natasha there. Natasha, are you there? It says her name, but looks like we may have lost her. All right, hopefully she's able to log back in. I'm not seeing her. All right. Mira, if you could just help to see if she might log back in. I'm not able to, doesn't look like her name's anymore. So hopefully she's able to join us again. I might then.
Here she is.
Oh,
she's here.
Great. This is what happens when we're live.
Yes.
Natasha, are you there?
Just give her a minute.
Yeah, we can hear you. Great.
No, I'm flipping between devices because my internet is very glitchy today. But I think I was just talking about the project and getting into advocacy. I think that was, we actually started the Immigrant Women's Association as a result of this project. I think was it was instrumental. If it hadn't happened, I don't know when we would have gotten around to forming an Immigrants Women's Association or even thought about it. And it was really, I think, to fill in the gaps that exist between the very important services that the Multicultural Association does provide and the mainstream services that are available in the community. And yet there was, the gaps existed. And how to sort of, how to find a way to make it easier for women who are immigrants or migrants or refugees. Non-status is a whole other set of challenges. We don't pretend that we have resources for that. We've always referred them to people who specialize in that. But even if you are status, which is primarily our membership, it's simply, there are so many challenges, networking being one of the most obvious ones, retraining, requalifying, not getting employed. Definitely there is a minority issue. You are not going to get the same kind of callbacks. You are not going to get the same response. All of those things matter. They're absolutely evident. That's why I think in every committee I've ever been on, which is often with Jeanette and with Liliana, I've always said if we don't talk about the anti-racism issue, immigration is just half of the picture. You absolutely do have to address the anti-racism aspect. You absolutely do have to address that it's not even always about race. It's often, my background is Muslim, so it's also about religious discrimination. It absolutely exists. And if by not bringing these things up into the public conversation, you're not desensitizing people, and you're not making it, you have to make it easy to talk about. It has to be something people are ready to talk about. They've heard it before, because just like what happened with the project which Jeanette was leading, just bringing it up over and over and over again, every space. People are now hearing it. They've heard it over and over again. They are now, they've heard it before. They're not shocked. And if you are that immigrant woman or that, refugee woman, and you have that problem, you are not there advocating for yourself, trying to get people to understand what you're talking about. It's a huge mountain for a single person to climb. And if we can, collaborate and put our resources together and do all the work that, continue with the work that all of you are doing, it would make all the difference. It can save lives. It can change lives. It's vital. And so that is with the Immigrant Women's Association. We started off with doing educational seminars, and it was really, again, to bridge that gap, because people assume that stuff you don't know, because the average woman born in Canada, raised in Canada, has been through the school system, does know these things. Immigrant women, if you come here as an adult and you are not an international student, which gives you a whole other layer of education, you are not going to know certain things. If you're limited to your house, you're going to know very, very little that you need to know. So it was really starting with informational seminars, very basic ones, and taking it to more specific ones on domestic violence, having to be sensitive, knowing we can't exactly advertise, put those words out there, because then people are going to be hesitant in coming. Almost every person who did attend would say, I'm here for a friend, not for myself. They may well have been there for their friends, but it's also possible that they were reluctant to say so. So it was really, a lot of it was education, and a lot of it was referral services. We've just recently gotten a very generous grant from the Canadian Red Cross to provide support for women and training for women during the COVID-19 pandemic, which I think we're going to get to later. But so that presents a whole other set of challenges with the isolation, the lack of networks, the lack of information. And being, aware of all the really desperate needs that a person can have when they're in these kind of situations. I wasn't even just satisfied just volunteering with that. So I was thinking, where else can I go where I can make a difference? And I think that's where I joined the Multicultural Association as well, and the Police Advisory Committee, and really literally everything I could think of to get the message out there that there is stuff that the general population, is simply not aware of. You're simply not aware because you haven't lived that life. And you might think that somebody who seems well-to-do, or who can speak English or who can speak French is just going to be fine. No, that's the baseline. There's so much that you're not aware of. And what I think is really important as an advocate myself is really the importance of cross-cultural education, because you need to educate both sides. You have to give immigrant women, all that whole category, immigrant, refugee, non-status women, you have to give them the information and the tools they need to empower themselves. And then you need to create that support outside in the outer community. And you can only do that by reaching out to people and giving them that information that they don't have, that these are the things, these are the challenges, these are the issues, and you never even consider them because you assume a lot of those things are known to people, but they're not. So those are, and I think advocacy, without it, advocacy research, these things can change populations, they can change the course of a nation. I think it's extremely important, and I'm very happy to be part of that, and thank you for inviting me.
Natasha, and thank you. I know you're very active. I know when we met last year, you're very active. You're sitting on a lot of committees. It's a lot of work that you're organizing. Congratulations on hearing about the grant that you've received for the association. And you're bringing up such important pieces, the importance of the research in order to be able to kind of, I'm sure, support some of this, like when you're applying for grants and for the work and for the association. And I wanted to come back to something that you just mentioned, which is also that some of the educational forums that you're hosting, and what you mentioned about the way that you might advertise for them, or what material might go out to the community, because I kind of wanted to follow up on that part. And I also just wanted to kind of know as well, when you were mentioning about some of the membership that for the Immigrant Women's Association, how you've been able to kind of do some of that recruiting or to reach out, that outreach, I imagine, is part of that.
Outreach is very important. And I think, like you mentioned, with advertising, we have to be very careful to know that you cannot say some things very bluntly, like the COVID-19 support program that we received. One of the educations that we are providing is domestic violence prevention. However, we're not going to put that on the posters because that might discourage some people from attending, and they might be the very people who need to attend. So it's there is absolutely a need for recruitment, but I think when you are very very authentic about what you are saying, I think a lot of we did not even have a website. We started with a Facebook page and just putting messages out there that were relevant, that women could relate to, who had been through similar experiences. That was enough to draw a lot of people. Like, we didn't have to do like really active recruitment. They just need to hear the message. They need to know there is something there that is going to help them. And it is true that for women in domestic violence or gender-based, you do need to go further, because we were having virtual coffee chats during the lockdown, because that was literally the only thing we could do. And there, I could see like our members, like the amount of people we would normally have attending, were getting less and less, and that was a concern, because the people who were able to attend were already professionals. They were already women who were doing well, and it was the people who are not attending. Those are the ones you're worried. Okay, why are they not attending? And we did some surveys and then found out that a lot of them did not know how to use Zoom platforms and did not even have access to their own devices. and most importantly, did not have any privacy. So that's where we came up with this proposal for this program, which was that during this time when you have quarantine and you're given the message that you have to stay home. First of all, the message stay home, I think I've talked about this in other places. I was very passionate about this. It's honestly, I know it had to be done. I know it was necessary, but it's like almost coming from a place of privilege, because if you are in a situation, that is the worst place you can be. And just, people need to understand that. And I would be going on like different news sites, and I would see that some people just did not have a clue because they had never experienced it. They had never been through that time where home was a place they needed to get out of. They would do anything to get out of that house. And it was that's where we came up with the concept that you need to have a safe space, even during a lockdown, and it should be considered an essential gathering space. We don't need to have numbers. You can have limited numbers, but you need to have a safe space where you can go to. Because currently the ones that were open were shelters, but it's not always about having a shelter to go to. You should have a place where you can speak to somebody that you can trust and who will understand what you're saying. So that was where we applied for that particular grant from, and said we'll observe all the protocols, we'll do all that. There needs to be a place, and we also applied for digital literacy training, because it's assumed that everyone knows how to go on Zoom, and a lot of people have never been on Zoom before and wouldn't know how to navigate it. So that was also important, as well as mental health and well-being, and teaching people how to cope. Not everybody has access to navigate websites. Some of them might be afraid that somebody else would look, and I think people are aware of that, but at the same time, you have to come up with a practical plan to deal with that.
Yeah. And thank you, Natasha. Thanks for bringing that up. That's so important, as you said, like having a safe place to go to. And we'll be able to kind of discuss this further when we get to the piece on COVID-19. And I appreciate also what you're mentioning around, taking for granted some things like, and we've heard this in some of our other roundtables too, like the existing kind of digital divide that they were talking about, and how that can also continue to exclude. And it's also really helpful to hear you discuss how the research part, I wanted to go back to that too, the research part and the ability to, and the need to define the problem, so that, as you mentioned, when non-status refugee and immigrant women might be entering spaces, it's not, as you said, a shock, where there's some things that are, that desensitizing, so that there's an awareness, the awareness piece really there, defining the problem. And that brings us to the next question, which is really thinking about challenges, because I'm hearing both you and Liliana have done such a great job to kind of walk us through how you might be addressing some of those challenges. And I can hear that some of it is there could be some geographical things, there could be the context, and I just wanted to give you an opportunity to maybe speak to some of those challenges further in doing some of this work. And we'll start again. We'll go back to Liliana, and then return to you, Natasha, and then we'll go to our final question, which is focused on COVID-19. Liliana?
Thank you, Natasha. That was really also quite a lots of good information, and really, when you were speaking, it reminds me how important it is to keep this issue alive and keep it at the front line, because there were other projects before, and a Multicultural Association, actually I was part of one project where we had received grant, and was called Immigrant Women Support Services, and we were able to offer more of the kind of field trips and sessions and fairs, where we brought all immigrants, all service providers who are serving immigrants, immigrant women, in one spot. And then we had a fair where they were talking about what they were doing, what is their role. And then we brought over 200 immigrant women at that time to come and see these service providers. So both sides were very surprised. Immigrant women did not know about all these services, wonderful services, and service providers had no idea that there were so many immigrant women in their community that are looking for these services. And I know that often, for example, even with the mental health and addiction services, some of their staff will say, well, when we ask about do immigrants access your services, they will say, well, what immigrants?
Mm-hmm.
They really not even understanding that there are immigrants in the community. So that's a really deeper and a bigger issue. So I am happy, and I saw the ad about your program coming up, and I think we need to partner. I think we can support what you're doing and work together on that. So maybe we can get in touch later on just to chat about your project. And in terms of the challenges and barriers for during the COVID-19 and your questions doing the community-based advocacy, I think Natasha has really spoke about a few things, and some of them, this a small number of immigrants in our community, immigrant women are not as visible in our community, and some of the reasons are sometimes they don't have resources, and I think Natasha was saying also they don't have means to, you know, participate in some of the limited activities that could help them with what they're looking for. So that's one of the main reasons, and for that reason we need to be more active and putting more things out there. We often find as a frontline service provider that other local service providers in our community, often if they meet with a newcomer or somebody who's from other culture, even if they're not newcomer, they've been here maybe for 5, 6, 7, 10 years, but because they have an accent or they look a little bit different, or they think they need to go back to the Multicultural Association and that we need to deal with them. Because they just don't have capacity or sensitivity to deal with those needs. So that's another challenge that we often see and we often face. There is also, of course, language barrier. That's probably the biggest one. And I know for some of us, like me and Natasha, who came here and had English when we came, that wasn't as much of issue. But when you have somebody who does not have English, who has many little kids at home that they have to take care of, so those are all enormous barriers to participate in activities, not just to access, but to participate just in the general activities and programs. And of course, now with COVID-19 situation, we of course can kind of be a witness to that too. That's the access to technology and not knowing how to use technology. So we work with a program, it's called Computers for School, or maybe that was an old name, but it's a program in the community that refurbishes all computers or laptops, and then they give them to communities. So we were able to access over 100 or 200 laptops through them. And then we were able to access funding to buy parts and fix those computers. So we have staff on site who are fixing them, and then we are able to give them to families. But of course, you just, you know, you first go make sure that every family has a laptop, and then, you know, once you give to each family, then you can go and look at, you know, maybe this family has 5 children and parents, and maybe they could use 2 because they need them for different things. So children need them in school, and parents need them to access language classes, and what Natasha was talking about, privacy. Often for immigrant women, privacy is an issue to access. And of course, lack of social supports and networks. That's a huge one because back in our home countries, women have a whole network of aunts and uncles and people who can, watch for their well-being and take care of them. And now here, they are all by themselves. They need to create these networks from, beginning. They need to create the trust. And of course, the cultural differences. How do you, approach such a difficult, such a complex issue as domestic violence? Where do you go? How it's just, it's I don't know how can woman who's I'm fortunate not to have such an experience, but it is really difficult to have family in your country of origin saying, no, you have to keep your family together. You cannot, put your husband in the jail. You need to be a good mother, good provider. So those are huge challenges so there's challenges on both ways, both sides for women, and the challenges for service providers being in the community like ours, where we don't have, as Natasha said, a long history of immigration, where, immigration's been, there was an immigration, like I've been in this country and in this city since, I guess, 1995, so quite some time. And I can, in this short period of my being here, I can see a huge difference in immigration in that time and now, and how, things are improving and getting better. But of course, we are far from perfect. So that's the challenges. I think we have a lot.
Yeah, thank you, Liliana, for sharing that, and as you said, the complex issues that it is. And I want to go now, just for thinking about time, I want to go now to Natasha so that she can share a little bit, and then we'll be able to kind of go to our final question, which focuses on COVID-19. Natasha?
Yeah.
So we just want to ask you as well this piece around some of the challenges of doing that work. And I think both you and Liliana did get to cover some of that in the first question, but just going back, thinking about the challenges of doing kind of community-based advocacy in the region.
By the region, you mean New Brunswick?
Well, I think in this case, it's best we focus on Fredericton, unless you'd like to, like, whatever you feel comfortable speaking to, Fredericton or the region.
I've been in New Fredericton the whole time I've been in New Brunswick, so my experience would be mostly about Fredericton, and the Association for Immigrant Women is also based in Fredericton. So all these organizations that I volunteer with are based in Fredericton. So it's a very Fredericton-centric experience. However, when I do discuss it with partners from other cities, they say, no, it's not just Fredericton, it's New Brunswick. So maybe it's more general than that, but I would say, yes, there is a challenge with doing advocacy in this region, because again, there has been immigration, there were immigrant families here and there, but there was no sort of critical mass that you almost need a critical mass of people to push for change. And I think they've done a scientific study on it, and it's 25%. You need that much buy-in from the population where you happen to live in order to be able to successfully advocate for change. And there is a resistance to immigration for sure, even if it's almost like there's two viewpoints. The provincial government is pro-immigration, but that does not mean they have buy-in from everyone in the community. There is a resistance. I think that the New Brunswick Multicultural Council is really, really active about promoting it and going out there in all the communities and trying to really sell it, basically, so people don't think that immigrants are taking their jobs. When you have this resistance, it does cause I would say a lack of motivation when it comes to service providers. I'm not stereotyping. There are some who are very enthusiastic about helping people, but it's really a roll of the dice. You don't know who you're going to get. And until there's a systemic sort of change, it's going to be very much, you don't know if the person you're speaking to is positive about immigration or they think it's a problem. So that does inform response. It does inform the trajectory of what women have to deal with, what whole families have to deal with when they have a problem, especially something as complicated as domestic violence. This is not a simple problem. This is a lifelong problem, and it impacts decades of people's lives and generations. So it's because it's such a nuanced problem, you do need to almost sort of you need to have people on board, and it's very difficult to change the whole populations, but you can absolutely bring service providers that are going to be dealing with these kind of issues, give them that special knowledge that they need, give them that information, so you almost have to create empathy. Not everybody's going to have empathy for people from outside, from people from who are outside the mainstream community, whether it's people of color, whether it's religious minorities, or just anybody who is looking or acting different. Sometimes there is a lack of empathy for people who need to be outside what you're used to dealing with. So it needs to be created, and it can be created. And I think that a lot of these organizations are working very hard on trying to create it, and that can only be done by constantly desensitizing people, constantly bringing up these uncomfortable topics, almost forcing discussions that may. Now, if you do it as an advocate, which I do, it doesn't always make you popular with everyone. However, if you're passionate about it, it does need to be done. And if you, every time you step back and you don't say it, you miss an opportunity. And it does, it's almost, again, we're talking about people's lives. We're talking about people in really dangerous situations. And whether, you're a born Canadian or you're naturalized or you're still not there, you're non-status, your life still matters. It's still important to help people who are, going through difficult situations. So just putting as much information out there as you can, informing people with the intent that you want to arouse empathy, you want to have understanding. It needs to be done. It is being done, and I've always said, yes, I know it's being done, but we need to take it one step further. It has to be deeper. It has to be, you have to really get to people. You have to really wake people up and make them see what they're not seeing. And it is uncomfortable, I think, for the average person. Like when you're watching television and you see a starving child in another country and you're thinking, what can I realistically do about this other than send money? That's one thing. But when you have people on the ground who are going to be dealing with these situations, yes, it needs to be done. And whatever you can do, it has to be done as quickly as you can, because the more time that goes by, the more people's lives can be damaged or worse. I don't want to be a downer, but that is what it is. So
thank you so much, Natasha, and I can hear your passion come through, and I had the pleasure of meeting you and hearing that, and I really, really appreciate the way that you are talking about this, and the piece around meeting a service provider at this, like maybe in one organization, and that there might be someone there who's working. And I remember this conversation as well, that there was this there can be a high turnover, or that person from the agency leaves. And that makes us think of how the problem sometimes can be being addressed almost in this individual plane, versus it feeling like it's becoming systemic, that we're viewing it from a systemic view, or that it's like institutionalized in some way, some kind of other thinking. And I appreciate the way you're promoting that, right? That kind of that next step where it's not just one or two within an organization, but that there's a shared understanding of what the problem is and the issue.
Yeah.
It's really important. Thank you for sharing that piece. And that really brings us to the next piece is COVID-19. So we're here in a context, the Roundtable series, this was already a crisis. Something that's been echoed in different spaces, but that was also mentioned at our first roundtable. And this kind of flows from what you just mentioned for Liliana and Natasha as well, is like that what was apparent during COVID-19 was also that we didn't necessarily have this national kind of shared understanding of what the issue was, or that this might have come as a shock or a surprise in some ways, and that communities have been, and settlement organizations and organizations have been like shock absorbers of all of this. And now it was kind of emerging in a way and really becoming obvious that, you know, how do we address this, thinking at in this kind of a national scope as well. So what you're viewing right now, for those of you on the call who have not seen this, this is another kind of visual summary of the roundtable that we hosted on April 30th that was focused on the intersectional impacts of COVID-19 against non-status refugee and immigrant women. And so, you know, this was already a crisis, being that some of the issues that were identified were issues that were already long-standing. And that also brought us to a place also of kind of this emphasis of then the experts, then those who should be consulted are people that have been doing this work, right? Like, it's not always about creating something new, but further supporting those existing supports and services that have been doing this groundwork that you're referring to. Both you, Liliana, and Natasha have been talking about, and taking this systemic approach. I think that what we would like in this next part, and this is our last question, is just kind of what was revealed to us, right? This inequality that was revealed, and some things that you mentioned earlier, both you and Natasha and Liliana mentioned, right, was this isolation and the social distancing. That was something that can be taken for granted. And groups that are already dealing with the distancing and the isolation that happens, right? And so we were really learning about the implications for non-status and refugee and immigrant women, and how they were already unprotected before the pandemic, and that they were also being impacted quite differently. When we started the conversation, Jeanette mentioned a little bit of some of the task forces that emerged, and kind of that coordination work that was necessary to address some of the crisis within the crisis. And for the next question, what I would like to hear from our speakers is more about this, some of what this really reveals as well, right? The question around how this work of community advocacy, how really centering non-status refugee and immigrant women, their experiences, the particular vulnerabilities, how that's especially critical. Like, it's a reflection really, like, that's especially critical at this time. And if you could speak to that, that would be really helpful. And I think both of you offer different perspectives, similar, your shared spaces, but also different perspectives from the organizations you're working from. Liliana, do you want to start?
For sure.
Thank you.
As a frontline service providers, we had experiences during the COVID-19 with a few cases of domestic violence and situations, and where we had to, intervene and help and be part of the solution. And some of the examples that we learned from there, for example, when we were looking for a space at the local transition house for a woman that had to, the police went into the house, and they had to, separate them. So we were looking for a safe space at the transition house. And what we, as we were going through it, first of all, Transition House was in the process of applying COVID-19 rules and regulations. And then one of the first things was, yes, we have a room for you and your child, but you are not allowed to leave that room. If you come in our house, you cannot go to any common spaces or anything like that. So that's it just sounded to us so brutal, to isolate the woman furthermore, even in a safe space that the system is offering. So we were in this situation. We had a free reception houses. There was no new arrivals at that time, so we were able to offer our reception house space for the woman, where she had access to the yard, and we were able to put some more services around her, because even social workers that were working with the child protection had kind of lots of barriers to responding on time in a timely manner and to support this. And in this case also the woman had had some health issues, so she had to access services at the hospital. We had difficulties, you know, nobody could drive people. The taxi drivers were limited and taxi rides. So we were, you know, luckily we have services in place at the Multicultural Association where we have a help settlement worker, social workers. So one person was working with a woman, the other person was working with the husband, the other person was working with a child. We were looking for the child care service at that time to help the woman to alleviate a little bit of you know, stress and challenges she was going through, to maybe have part-time childcare during a day where, you know, she could take care of herself. And we were working with the child protection workers and we couldn't do anything. So definitely we were witness of, you know, COVID-19 reducing and already, you know, not the best services, but reducing access to those services in a big way. And it had a big impact. It has a big impact on situations like that, where, you know, it's a crisis situation. So we had also not being able to work at that time, even in our sector, we were not allowed to, you know, offer face-to-face services. So we had to do most of it on the phone, online, and to be able to support people in crisis like that. So COVID-19 definitely made it more challenging to offer services and also to engage local service providers who are supposed to be there and support services and support families. So I believe because of that, the situations or the crisis was prolonged. It, you know, wasn't as efficient and effective as it could have been. And that makes really a big difference for people that are going through those challenges. So I know that also there was we were working very closely with the education department, and I know that New Brunswick Multicultural Council has also task force groups where we work with the schools and education, where there was a very similar concerns and challenges, you know, for the children not having a safety at home. That what Natasha was mentioning for women, you know, not feeling safe at home, but was same for children. So really makes it more complex in the situation where children are involved, and how do you make sure that everybody gets support? I don't know. I don't have an answer for that, but definitely was challenging. We are lucky in New Brunswick. I don't know, don't want to brag in front of the people who are in Ontario or Quebec on this call, but we are lucky in New Brunswick that we are still in a, thinking it's an orange phase, but it's kind of very mild to compare to a red phase that some of the rest country is facing still with the COVID-19. So we feel a little bit of relief. And we hope, you know, that will stay and continue for better in that way. But we really just, we had enough, and it's good. It's good that we are able to go a little bit back to the new normal.
Thank you, Liliana. Thank you, and we hope so too.
Wish you the best.
Yes. Yes. Yeah, different, you know, when we were speaking about the different stages that we were at, and we were able to kind of learn from each other in these conversations as well. And I'm glad, Liliana, you did a really great job sharing with us also, like, all these different layers. Like right now, when you said the taxi, when you said that there's all these different moving parts and all the things that were not available that we may have relied on at that time as well. So there was definitely lots of challenges there in the way the work shifted. what people kind of had to improvise, how they had to improvise in that time. I want to bring back Natasha to share and reflect with this final question as well. Natasha?
Okay. Can you hear me? You can hear me? Yes? Okay.
Yes, we can
So,
hear you.
so yeah, no, I think I did bring this up a bit earlier. It was just a complete disaster when the lockdown happened. I know that a lot of people were focusing on the virus, and it's just looking at the whole situation and having an idea just how isolating and how terrifying this would be for somebody who isn't from the community, doesn't have those networks, doesn't know all the resources they can connect to on the phone, maybe doesn't even have the ease of going on Zoom with many, many people. All of that just occurred to me that, oh my God, this is going to be bad, really, really bad. And worse for some people than actually catching COVID-19. So it was it was really obvious, but at the same time, I could see that there was a sort of there was a divide between how people were responding, and some people were completely focused on the virus. And I was just thinking of all the impact it was going to have on people who weren't connected. And I think there's another aspect to it. I think it might be regional, because New Brunswick, again, is newer to immigration. But I think just having contacts, people that you know on a personal level, whether they're friends or their family who happen to be service providers, makes a big difference to your level of comfort and your level of knowledge and your just general ease when you are in a situation that is so unusual, like the lockdown. It changes. There's just a different level of comfort that you can see with people who are, I hate using the term from here because it's been used so often whenever people meet you as, are you from here? But it makes a difference when you're not, you didn't have the family growing up somewhere, you don't have those connections. And it does change how comfortable you are, because you don't have that friend or that family member that you can just call and speak to, because then it's on a professional level and it's a professional level only. So there's Mondays to Fridays. There is, it's different. It's very, very different. And I think whenever people talk about challenges that, women face or just anybody faces, I say, okay, you take that challenge and then you multiply it, because it's going to get every single layer that you add. That's why intersectionality is a term. Every single layer that you add, this not being your first language, being a person of color, being an immigrant, being a minority, cultural minority, all of those are check, just tick them and multiply that problem. And it just gets harder from there, unless you have some incredible advantage that you happen to be, born in a specific family and you're just elevated above average people's lives, but that's not typical. So I always say, take this problem and magnify it, multiply it, because it's going to be that much worse. That person is not going to have that knowledge, that information, that comfort, that understanding, those friends. All of those things are going to change your experience. When somebody who's an immigrant is told you're going to stay home, I can just picture they don't really have any other person they can speak to who knows any more than they do, because their immigrant networks tend to be immigrant networks largely, unless you're in a workplace where you can sort of navigate above that. But that is, you tend to have largely immigrant networks, and that's why it's not just the generation that moves here, it impacts children. Because again, I think there was research to show that children's networks are impacted by their parents' networks. So I wasn't just worried about what was happening with women. I was thinking the impact on immigrant children was going to be so significant. And I think that was another project we applied for, which we also got, which was a smaller project, but that was from Horizon, which was to provide mentorship for immigrant children during COVID-19. So these are vulnerable populations in every sense of the word.
And maybe Natasha, just to add to that, that's where really cultural brokers could play a big role. And for the women who unfortunately don't have enough English to, to be able to speak to that service provider who doesn't speak their language, this is where trained cultural brokers can make a big difference. So immigrants in the community who have learned about some of these challenges and issues and can really give a proper suggestion or advice to a person in the going through a situation, where to go, what to do. It's important to have that, as you highlighted. Immigrants to immigrants, they only have this much information, but if we are able to provide all these different ways and workshops, and if immigrants who are able to attend those workshops can attend them and learn more, then they would be the right people to give advice, what you can do, where do you go, how you get the best of in your situation, because you don't want to re-traumatize, or you don't want to keep this. It's very different how this society works with domestic violence issues. In the past, we had lots of examples where even people, other immigrants in the community would advise a woman, stay put, take it, you have to take it for the sake of your family, and you have to take it for the sake of your children, don't make a big fuss, don't go to police. And from all the training that we have got in the past, we know that if violence happened once, it's most likely it will happen again and again and again. There's no guarantee that if I forgive him this time, he's not gonna do it again. So we need to make sure that the people that are around the women who are in these situations have right approach and have right information and can give right advice. So that's why I think the role of the cultural brokers is crucial, and it's important to continue work in that direction.
Thank you to both of you. And just to kind of circle back here to also what Natasha, thank you also for, you emphasize this kind of intersectional side of the reality and of the lived experience, and that perhaps we know, that kind of more common phrase that violence does impact all communities, but what you're emphasizing there too is that the experience and just even the pathways to support and healing are impacted, by all these different kinds of systems and realities that you're mentioning. Yeah, and I appreciate, Liliana, as you mentioned, like the work of that kind of cultural broker as well to make those connections that might be outside of more just the formal kind of spaces where people get help, but like as a connector within the community as well. So that's really important. I want to give Jeanette a few, if you'd like to make any last kind of comments to this question in particular, go ahead, because we still have a few minutes and then we'll be able to wrap up. Go ahead, Jeanette.
Absolutely, and I just want to thank Liliana and Natasha so much for their comments, and there's a reason why I recommended them for this panel, is because they have tremendous knowledge and experience to be able to talk about these things. And it's also really interesting to hear about the different ways that they do advocacy and the different kind of liberties or restrictions that they might have from different organizational perspective. And for us at a provincial level, we try to bring what we hear from them from the frontline experience and working with newcomers directly, and how can we kind of bring that upstream and do a little bit more provincial advocacy work and look at some of those bigger complex issues. So there's so much that they raise that we're trying to work on it at a governmental level and provincial level, that it's so important to continue having these conversations, that feedback. Specifically with regards to COVID, I think, Natasha hit the nail on the head when she said, when the lockdown happened, the people who are sensitive to these kinds of issues, I'm pretty sure I had the same reaction, just a knot in my stomach of thinking, oh, this is going to be so much worse for some people. And I went straight to kind of domestic violence. And as an organization, we went straight to that space as well, and kind of thinking of newcomers who are already isolated, already having trouble finding work, already having trouble connecting with the community, already in precarious situations. How is that going to impact them? And so this is why we started the task forces, because we knew that, as Natasha mentioned, newcomers have broadly also newcomer networks and might not be tuning in to the 2 p.m. Justin Trudeau show and trying to get the information that way. So we needed to make sure that any kind of information on, say, like federal supports, the CRB, any kind of changes to permanent resident statuses or any kind of supports for newcomers were communicated to the communities that mattered. So the way that we organize our task forces, as I mentioned, we had a case management task force, which is a little bit more at the very early stages on kind of crisis intervention and just making sure, like, okay, are people fed? Do they have a place to live? Do they have food? Are they in a very precarious situation? And then if we could address those very urgent needs, then okay, what's the next phase of making sure that people are supported and have, when people started going back to work, like, do they know their rights? Do they know that they can decline work? Do they know how to, how to protect themselves? Do they have all the proper equipment? That kind of stuff. We created a communications task force. So we reached out to try to really broaden our communications reach, especially through ethnocultural agencies, and to translate a lot of material as much as we can, or find translated materials where we could, to make sure that we were communicating information about the CRB, about supports, about provincial Medicare and all that to the newcomer community, so that we'd have access to that information, including through the networks that they access. We had, as Liliana mentioned, a youth task force, so really very wary of youth mental health, the youth connectivity. We worked with the Department of Education to connect all newcomer youth that we could with their own devices. So they provided laptops or iPads to youth across the province so that they could stay connected to their coursework and to their friends, and try to think of different ways to reach out to youth and engage them in some mental wellness and kind of other forms of connection through the province. And then finally, we had a tech task force, which is to make sure that we were kind of looking at cybersecurity and making sure that our agencies were connected among themselves and could continue doing the work. So these task forces were really helpful in that crisis moment and helped to some degree abate those kind of crisis situations, which would reach the communities that we needed to. But much like Natasha mentioned, I think there was a lot of fear that the COVID would impact some people in very, very dangerous ways, and we wanted to make sure that they had access to the supports that they needed. So we're very lucky, as we mentioned, that we're able to maintain to return to some kind of new normal, and most of our services have resumed to some degree in person, and we're hoping to abate a second wave as badly here in New Brunswick, but in rural communities and where there's lack of connection and still some isolation, it remains a big concern for us that the right people are being reached.
Thank you, Jeanette. Thank you for sharing about the task forces, and I hope it's something that can, as you know, I know we've talked before about it, that it can be sustained, that it was responding to the crisis, but given that we know there was already a crisis happening, that it seems that they're much needed. And that work can maybe be sustained. So thank you to everybody. That concludes the roundtable discussion part, and we're so grateful for all of your contributions. And thank you. I really do want to say thank you to the speakers, Natasha, Liliana. Thank you for taking time, for sharing your insights and your practices, and for being a part of this roundtable. And we hope that you are still connected to our project and that we can continue to collaborate and work together. And thank you to Jeanette from the New Brunswick Multicultural Council as our co-host today. It's a lot of work to coordinate and organize these types of sessions, promote the material, and get everything happening. So thank you so much. And a big thank you to our Advocacy team, Nira, the National Steering Committee of this project, who's been providing like ongoing support and feedback so that these events can take place and happen. We hope that today's session, there's a lot, we've been talking about a lot of the challenges, but there's also something, and I think this came up through the discussion as well, that that we can feel hopeful as well, because these discussions are happening and the awareness is happening, and that's a really important part. That desensitizing that Natasha was speaking to, like, that's a really important part. So again, as we mentioned, our project is coordinating and supporting the infrastructure of advocacy and survivor-led work through the community advocacy networks, through the peer champion piece. That's work that we really want to continue to work with each of these different regions to push responses and interventions in addressing gender-based violence against non-status refugee and immigrant women. What you're seeing on the screen right now are 3 ways in which you can stay connected to us, stay involved, stay up to date with our future activities. And something I just wanted, this is our last session of the Roundtable series. We started this now a while ago, but I want to say that we are going to be hosting on November 26th and November 27th from 1 to 4 p.m. Eastern time. We'll be holding a conference, and the idea there is that a lot of this kind of thinking and reflection that we're doing, this kind of sometimes what we call kind of this messy work that happens, it comes out with just, you know, ideas through conversation. We'll be hosting that in the late fall, and we hope that people can attend. So please sign up for our mailing list so that we can keep you posted. We'll be sending out a save the date for those, and more details will come with our agenda and our schedule for those dates and activities. So thank you very much. It's 4 o'clock. Thanks to everybody who's joined the call. I only at the end got to see the chat, but it was spirited, and there was some smiley faces and some great kind of comments for the speakers, and it seemed very dynamic. So thanks to everyone for participating. Take care, everybody.
Thank you, everybody. Take care.
Thank you. Bye.
Thank you.
Mira, I'm going to stop the session, so it's probably going to close on us. You're on mute.
Mute again. Okay.
All right. Thank you.
Thank you.
Thank you, Mira. And I don't know, who else is still on? We've got a few people. Thank you, everybody. Oh, you're still on, Natasha. Take care. It was so great to see
Bye,
you.
Natasha.
Bye.
Thank you so
Can
much.
you close out because I can't seem to log out.
Yeah,
Yeah,
I'm going to
we'll
close
do
it.
that.
It's going to exit now.
Thank
Bye,
you.
everybody.
Bye-bye.
Thank you. Ah, found it. Okay.